or global, affecting women from everywhere.
All right. Hey, everybody. We are back with another PPCM Chat. We have Heart Sister Miss Nicki with us on the line today. She will be sharing her story about her PPCM experience. So stay tuned. Thank you so much, Miss Nicki, for joining us today. We would love to hear more about your story and how you're overcoming and how you're dealing with, your PPCM and how things are going with you today.
Hey, today everything's great, thankfully. But my son was born in 2018 in February, and he was induced because of preeclampsia, and so he was induced a couple of weeks early. It was a 2-day labor process, so it was long. And after his birth, I did hemorrhage. And so we had a lot of issues, after that, requiring blood transfusions. And of course, they did bolus fluids. So it was an interesting start for him. And I wasn't diagnosed with PPCM until 5 days postpartum. And I was gurgling and having trouble breathing while I was laying down. So, as a nurse, like the worst patient ever, I'm thinking, fluid overload from, the emergency meds and from the bolus fluids. And I'll just go in the morning and they'll diurese me really quick and I'll be right back home in 2 hours. No worries, guys. So, that morning I got up and out of breath and just sitting still having conversation, out of breath, and I called my OB thinking, like, I'm not even going to the ER, guys, right? Like, we'll just handle this, we're good. So of course they advised me to go to the ER, and I was like, great, well, let me just sterilize some bottles and vacuum and do the dishes in case anyone comes over. And so got the house all in order and drove myself to the ER. And that's when they diagnosed me, luckily that day. Like, a lot of our sisters are misdiagnosed or, brushed off for anxiety. But I was really, really lucky that, the ER was super responsive and seemed to have very informed, medical professionals. So, but my ejection fraction was 15%. And it was, it was an interesting couple of days. So I was inpatient for a few days. And the only thing I remember is that I recall reading the same research that the attending cardiologist was speaking to me about, in the hospital. And so the only information I had was like 3 studies from Dr. James Fett, who is like all of our greatest heroes. So, and it was just bizarre to me that they were saying, ACE inhibitors and beta blockers, and this is what you'll do. And it was like, they were reading from his playbook, thank God. I don't even recall what my BNP was at the time because no one mentioned it. And, it's just something that I feel like if we can get that out there and have the simple blood test for people, then they may not have to end up, in the hospital in crisis with an EF, presenting that low. So, it would have been great to have this information. And even as a nurse, I'd never heard of PPCM. I was able to advocate for myself just based off of the research that I was able to find. But, it wasn't anything that had ever been spoken about to me through my career. And I think as women, we minimize things. So we say, oh, well, I'm having a hard time breathing. Well, it's just because XYZ. And we're like conditioned to just, push everything aside, be really, really strong when in reality, we have to get that information out there so that there's a line that says, hey, if you're experiencing these symptoms, then be strong all the way to the ER, or, reach out and ask.
Yes. Oh my goodness. I agree. I agree. Especially with the BNP blood test. I mean, like I didn't even know about none of this. Like I said, we went through the loss of my sister, but even then we didn't know anything, like this. And then even being in the medical field to just know that it's not heard about, probably not talked about, discussed, or maybe you didn't hear another patient or, going through it or anything like that. Cause I mean, um, I don't know how they really pass information. I'm pretty sure they don't because the HIPAA. But other than that, like just not hearing those stories at all and knowing that it's a leading cause of maternal mortality death, why is that not something that mothers are warned about? So yes, were you given anything like as far as treatment wise? How was your treatment after you was diagnosed with PPCM?
So I was treated initially with, they diuresed me in the hospital. They pulled 40 pounds of fluid off of me in 2 days. And they started the beta blockers and ACE inhibitors. They did give me the option for a life vest. And at that time, I think I was just so overwhelmed, and I was like crying to everyone. I was begging the janitorial staff to, release me from the hospital because my 5-day-old was at home, and my concerns were about his safety and wearing the life vest. Looking back, I'm really, really blessed that, everything, that I didn't have a sudden cardiac event, because the cardiologist, ultimately agreed with me that if it was something that I wanted to forego, that I could safely. And he did explain, the risks, but my cardiologist is more of a don't eat too much salt, don't drink too much water, see you in a year for your follow-up echo. Um, so it was minimal, but I was like in the hospital bed and found the Facebook support group for moms with PPCM. And that's when, some relief started to wash over me, because these people are like sharing what they've been through. And, you Google things, and as a nurse, you know better, but you Google things and you're looking for like, research articles, and there's just, it, of course, with Google, you're going to die in 3 days if you have a headache. So, God forbid you type in, peripartum cardiomyopathy, right?
That is so funny. Oh my goodness, that is so true. I remember looking up those articles and I didn't see a lot on there, which was why I initially wanted to start a foundation to be able to bring more awareness, because I'm like, okay, well maybe if we would have had more information out, we would have known what to look out for. I mean, that to look out, well, if a doctor run your urine and it has protein in it, then that's preeclampsia. But we don't get anything about our hearts. Like, and they say that our hearts is doing majority of the job while we're pregnant. So it's like, well, why wouldn't you focus on the heart anyway, even if it is normal? Because we're told that, oh, it's normal, it's fine, your heart is going to grow enlarged and it's going to go back to normal, everything is going to fall back to normal. And then what if it doesn't? What if you have that patient that doesn't go back to normal? But how would you know?
Yeah.
You know, so oh
Yeah.
my gosh, that is very interesting. And to know that you're in the nurse field, oh my goodness. And did it make you feel bad any for like, how did it make you feel being in the medical field?
I really just kind of put all of that aside, and I was very deer in the headlights, because my career in nursing has been in home health and hospice care. So, I was not a cardiac nurse. I know how the heart works. I know how the body works. But sometimes that information can be more harmful than helpful if you're not specialized in that field. So I very much took the deer in headlights approach, and what can I find that's like medical research, And anything other than that, just kind of tried to block it out and deal with exactly what was in front of me. But it's funny because I was always afraid pre-pregnancy that, because when I found out that your blood volume doubles during pregnancy, my first concern always was not, oh, pregnancy's uncomfortable, or, the changes in your body, like, oh, I won't be so cute anymore. I never cared about those things, right? I was just like, your blood volume's, it doubles, y'all. Did y'all know that? And no one seemed to be worried. They're like, every woman in history has been through it, and you'll go through it and you'll be fine too. And so the irony of ending up with pregnancy-induced heart failure after,
Yes. Wow. Oh my goodness. And with the obstetrician, so with their obstetrician, were they familiar with anything that you had went through, or was they concerned about any symptoms, or the symptoms that you were having, was there anything that was concerning at one point during your pregnancy? Like, did you feel a heart flutter, or did you feel, out of birth extra? Did you get extra swelling? Like, how was the actual pregnancy leading up to like your prenatal visits, and how was that flowing?
So everything was normal until probably about 7 months in. And when I went in for just a routine checkup, of course, I did have, some edema in my feet and lower legs, but it was nothing that was very concerning. I was also at the time morbidly obese. So a lot of things, me having more difficulty breathing was kind of expected because I was larger and, in my mind, right? And so when I go in, they're like, oh, well, you've gained 12 pounds since your last visit, but it was just the holidays. I'm sure you ate a lot of sodium at Thanksgiving, and, your blood pressure's fine. Everything else is fine. It never occurred to me to tell them that, hey, I'm having more difficulty breathing with activity, because I mean, obviously, right? You're 7 months pregnant, you're trying to do anything. And with already being so large, like, obviously breathing wasn't easy anyway, right? So it was just like, oh, this is fine, everything's good. um and they really weren't concerned about anything until the protein in my urine, and the preeclampsia prompted them to have me scheduled for induction.
Wow, wow. See there. Okay, so with the preeclampsia, and then we are, now with the new studies that we know that preeclampsia is obviously that risk factor of developing PPCM, and that's very interesting. And then for that's so true that we don't know exactly what to bring up in visits. Like, they're so quick. I'm not sure how quick your visits are, but I know they're at least under 15 minutes sometimes, because they have to, they have more patients to see. And it's just like, well, what can I think about within these 15 minutes? Well, everything is normal. I think everything is normal. They ask you, oh, well, how do you feel? Or is everything going good? Yeah, 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 yeah. And everything is yeah, instead of, well, and then you leave the office and you be like, oh, well, I did forget, probably to mention this or that, but you don't think that it's that important or that crucial.
Mhm.
So yeah, that's very true. That is very true.
And it's
And for
mind-boggling to me because they test your urine for protein, and then
Mhm.
find out that they're concerned about preeclampsia, and then they follow that by drawing labs and just don't run a BNP. But
Mm.
you've done all of the physical steps it takes to get there. You just don't check that box on the lab slip. Like, that seems almost negligent, but
Right. And did your obstetrician, were they aware of your condition? Like when you went to your postpartum visit, did you get to make it to your postpartum visit? Like, well, you didn't, because you said 5 days later, so you didn't even get to your 6 week checkup. Like, how did that go?
no, so I was hospitalized for 2 days, and then I did make the follow-up. But while I was inpatient, the OB group that I was working with had someone come visit with me every day inpatient, to check in on me and to monitor my progress. So they were really, really great. They were really focused on my mental health, which is nice. But they were almost just popping in to kind of keep all the information flowing. It was really nice to feel supported by them. And I know mental health it's super important for new moms, for anyone, to be monitoring that. But it was so bizarre to me that when they came in, they were offering me anxiety meds and meds for depression. And it's like, well, in 6 weeks, when these meds kick in, I probably will not still be sobbing relentlessly because this is situationally appropriate. Like, thanks for asking. Where's cardiology?
Oh my goodness, yes.
But
Wow. And
they
well, I'm glad.
really did follow up with the process. I don't know that, it changed anything that they do, but I think that I was really lucky in the way that a lot of our heart sisters are not.
Right, right. And do you think it was because maybe you were in the medical field at that time, or were you kind of familiar with everyone already, or was you at a total different hospital?
So I did go to the same hospital where I birthed my son. But I'm like a ninja nurse. So if I'm in the hospital or any of my family's in the hospital, they're like, what do you do? And I'm like, oh, well, right now I'm on maternity leave. It was so irrelevant to me that I was a nurse because I was not a cardiac nurse. I was not an OB nurse. And so I really wanted them to, and of course, every nurse that comes in to care for you, like, zones right in on it. And it was a big joke. They're like, "Oh, you're the secret nurse on the floor. Okay." And I'm like, "Hey, I'm a nurse, but you are the nurse. Like, let's get this straight right now."
Okay, like the roles that totally switched now.
Yeah.
Wow. Wow. Oh my goodness, that is interesting. And so like as far as having them coming in checking on you, your mental health, do you think that it probably would have been helpful or anything if they would have had kind of pinpoint you to like some success stories or survival stories, or like had a PPCM advocate maybe, or somebody that was kind of familiar with what to expect, what your treatments can be? How would you think?
Yeah, that would have been amazing. I think that, obviously anyone hears heart failure and they go into, panic mode and in fear as a response. And so that really clouds your ability to seek the information that you need to, and not knowing where to start. It's really nice to have support groups like the one that I was able to find on Facebook, but to be able to have an advocate that could speak directly to you, that could kind of, explain the diagnosis, explain the test results that you're confused by, and from a place you know, of having been through it themselves or of, their families having gone through it. That's just huge. Every patient needs an advocate, and that's like my favorite part about being a nurse is advocating for my patients. But to be able to provide that for someone who's just, terrified, and they have this new little baby looking at them, and or not, because they can't get home to them because, from their perspective, they may not see them again. And just to have someone who's really gone through that and can, I think it comes from a different place than, as a medical professional, when you're treating your patient, you're doing the best that you can do, but you're treating six other patients in six other rooms. And, um, so to have someone make space for that with, the education and the lived experience that would be amazing.
Right. Oh my goodness. That I love that. And that is exactly what, we're trying to create, to be able to have more advocates out there and be able to partner with hospitals and the medical offices so that we could have more support out there, because obviously I think in 2011 was the last study where it said 1 in 1,300 women was getting diagnosed. But I mean, years have passed, and we know for sure that it's that number is trickling on down. So it's like I'm glad you said that, because it is so good to be able to have that information out there. And what would you think, or what would you mention to another mom who may experience PPCM, or what would you want another mother to know, or even a mother who probably, maybe think that she wouldn't develop this condition, as from a nurse standpoint?
Well, just knowing how easy it is to do the self-check, to go through the self-checklist and, identify any symptoms that you may be having. Just it's something that's so simple. It's a really easy tool to use. And I think all pregnant women should know the signs so that they can keep an eye out for those symptoms. And there's no reason that they shouldn't be able to ask their provider for a BNP if they're experiencing, two or more symptoms on the checklist, just to really start with the basics of, this is what this is. And I feel like in big bold print at the top, it should be like this, this is a maintenance condition. This is terrifying and this is manageable. And, but just getting the information out there to people so that they can advocate for themselves, because people, in all different walks of life, from, all different sorts of professions. I was deer in the headlights, and, I'm from a medical background. So, just getting that information out there so that they know at least just a bare minimum. A lot of people think, well, oh, well, then you're instilling fear in pregnant women, and why would you want them to be so afraid? And, there's power in information. So if they have it and they never need it, then no harm, no foul, right?
Yes, yes, like with all those pamphlets that we leave the hospitals with, and all those discharge papers and stuff that's telling us what to do and what not to do, and a lot of us kind of just put it down.
Yeah.
So,
Yeah.
yeah, yeah, so that is so true. So I agree. They should definitely have PPCM screening along with preeclampsia. I believe the glucose test. So like just all those testings that we do. I mean, why not just squeeze it on up in there? I mean, that's a good question. I thank you so much, Miss Nicki, for coming and sharing your story with us. I mean, I know that it's not easy being able to talk about these memories that we, had to actually go through as personal experiencing. It can be definitely triggering. It can be definitely just a whole awakening for us. And so I really thank you, appreciate your time, and sharing that with us. And if there is nothing else you would like to share, I would definitely be able to close us out.
No, just thanks for everything you're doing to get everything out there and to make this information more available. That's so special.
Oh, thank you. Thank you so much. Yes, I'm here for my heart sisters. I'm like, we got to get our stories out there. Like from the beginning, when I first started the Let's Talk PPCM blog, when it was a blog page, I was just dedicated into like, oh my goodness, there's so many stories out here. Like nobody is seeing these stories. Like if we would have saw these stories, my sister probably would have lived. Like, and I probably wouldn't have been all the way in heart failure had I had known it was a test, to be done. So yes, we're definitely going to be continue to push for that. We're going to push for awareness, and we're going to do this thing.
Absolutely. Absolutely.
All right, guys. Well, thank you so much for tuning in to our PPCM chat. So with Nurse Miss Nicki, and we will see you all again on the next PPCM chat. Thank